Good afternoon to all of you. My study on an observational study of triglyceride glucose index in normoglycemic, prediabetic, and type 2 diabetes subjects and its correlation with HbA1c as an indirect marker of insulin resistance. Introduction. Insulin resistance, it is the hallmark of type 2 diabetes. Its aims and objective. The aim of this study is to triglyceride glucose index in normoglycemic, prediabetics, and type 2 diabetes subjects and its correlation with HbA1c as an indirect marker of insulin resistance. Methodology. In this study,
Anything? Both are the same or something else?
same, ma'am. Only just
So it is not a message for all those who are planning for next aims are always one aim. It is always one aim for any study, and objectives are so many. So it is not the same. So you can. What is your aim of this study?
ma'am, the classical method for insulin resistance measurement is like homeostatic model assessment, HOMA IR method, or euglycemic
नहीं इतने
hyperinsulinemic
सारा नहीं
clamp
होगा.
method.
You select one. एक ही एम होगा.
Just
एक
to
करके
compare cost-effective method.
आप इसमें कौन सा एम एम को क्या बोल which aim is in this study?
For the insulin resistance, cost-effective method by triglyceride and glucose index measurement.
Ha, that's fine. Very good. Okay, fine.
So in study, we select total 483 patients who were enrolled in the study, and the patients are divided into three categories based on HbA1c criteria. Normoglycemic having the HbA1c less than 5.6, pre-diabetics 5.6 to 6.4, and diabetics HbA1c more than or equal to 6.5. TYG index was calculated using the formula a log fasting triglyceride into fasting plasma glucose divided by 2. The TYG index and its correlation with HbA1c was assessed using the Pearson coefficient. Results. Out of the 483 patients who were enrolled in the study, male to female ratio is 41 is to 59. Out of 483, 161 are normoglycemic, 161 were pre-diabetic, and 161 were diabetic. The TYG index showed significant differences with average of 4.62 plus minus 0.21 for the normoglycemic group, 4.82 plus minus 0.23 for the pre-diabetic group, and 5.17 plus minus 0.35 for the diabetic group. The TYG index and the HbA1c Pearson are 0.680 and p value is 0.001, demonstrating a strong association between poor glucose control and higher TYG index. This is the graph for the TYG index and HbA1c showing the linear correlation between these two parameters. The conclusion, the study demonstrated that the TYG index is having a statistically significant correlation with HbA1c. The correlation between the TYG index and HbA1c demonstrating a strong association between poor glucose control and higher TYG index indicates the indirect relationship between the insulin resistance and TYG index in patients with type 2 diabetes mellitus.